Hello and welcome to yet another edition of COVID-19. For the first time in a week, Korea's daily tally has jumped to the triple digits, and authorities are reiterating calls for public caution as they brace for a possible rebound in response to the recent movement of people to mark the Chuseok holiday. Also, authorities have disclosed the results of their findings of the flu vaccines that had been stored outside of the required temperature. I have our Kim Han-il with details on that later on. But first, here is our Kwon-soo with the updates on the pandemic for Korea and elsewhere across the globe. So there's been a jump in cases, as I mentioned. Please tell us more.
Yes, Sunny. Korea reported the first triple-digit caseload in a week. The number we're seeing here is 114 this Wednesday, with some 94 domestic infections. And it is a rise by almost 40 cases compared to yesterday. So we are seeing quite a jump here. But if we take a look at the on-week rise, it's actually almost the same figure we have been seeing last Wednesday.
Right. So, now, given the recent rise in cases here in Korea, should we be worried about a possible new outbreak?
Well, now that we are midway into the week, the rise in cases may be a natural result of more people getting tested for the coronavirus past that Chuseok holiday. And that is why officials are saying that we need a little bit of more time to assess the overall situation. And also, authorities mentioned that this triple-digit figure that we are seeing today does not necessarily reflect the current situation. But let's take a closer look at Wednesday's figures. The total accumulation stands at 24,353. We have 3 additional fatalities, raising the death toll to 425. A little less than 1,600 people remain in quarantine, while over 250 people made a full recovery from the coronavirus in the past 24 hours. Now, in the meantime, emerging cluster infections continue to break out, such as at medical facilities. A hospital in the capital, Seoul, reported a total of 47 infections with 1 additional case, and also north of Seoul in Gyeonggi-do province's Uijeongbu, another case of hospital infections, which reported 13 cases, raising that total to 14. And a cluster infection at a military base in Gyeonggi-do province's Pocheon is also causing concerns, with so far 37 cases reported there. And a village in Jeollabuk-do province's Pocheon city, that is also causing concerns following a family group infection, and 3 additional neighbors have been confirmed there. And the cluster infections that I just mentioned are part of the reasons why we are seeing the highest numbers of infections in Gyeonggi-do province, the capital Seoul, and also in Jeollabuk-do province. And meanwhile, we also have 20 cases that were reported from abroad, categorized as imported cases, and those came from almost a dozen countries. And speaking of that, let's take a look at the global figures. 7.7 million in the US, 6.7 million in India, and almost 5 million in Brazil. And around half of these countries we're seeing here are reporting over 10,000 cases on a daily basis. If you go over to other places here, France and the UK are seeing over 10,000 new infections here as well. And there are also concerns in Iran, which is also still seeing resurgences. So many countries, there are many countries that may even see over 1 million cases in the next week, which is what the World Health Organization and many experts are worried about. And with that, let's take a look at the total accumulation of cases at 36 million, and over 1 million fatalities and 27.1 million recoveries. And those are the figures I have for now. I'll be back with more tomorrow. Back to you, Sunny.
All right, so thank you for that. Just a little clarification there. The family cluster infection we're talking about is in the city of Cheongup, is it?
Cheongup, yes, that's right.
All right, so I'll see you tomorrow. Thank you for that. Right, 2 weeks ago, the government's free flu vaccination program came to a halt following news of improper storage while the vaccines were in transit. Now, quality tests were conducted and the results of those tests have been disclosed. As I said, our Kim Han-il is here in the studio with details on that. Welcome, Han-il.
Good afternoon.
Now, Han-il, tell us about the results of those studies.
Sure, the test results are in, and the good news is that there's nothing wrong with the quality of these vaccines that were mishandled. So the KDCA conducted tests with the Korea Ministry of Food, Drug and Safety to see if the vaccines may have been compromised during transit, and the answer is no. The Ministry of Food and Drug Safety conducted quality tests on samples collected from 5 different regions in Korea that could have potentially received the vaccines exposed to room temperatures. The results came back safe on all criteria. Additional tests were conducted on around 1,300 vaccines that could have been rendered ineffective, and they were deemed to be safe as well.
Right. Hanel, I hear that authorities also conducted a test to see how long a vaccine can last if it is stored outside the recommended temperature range.
That's right. So multiple health authorities have conducted lab tests, and they expose the influenza vaccines at different temperatures to test their efficacy. So the Ministry of Food, Drug and Safety, along with vaccine manufacturers and the Korea Pharmaceutical Test and Research Institute, exposed the flu vaccine at 25 degrees for 24 hours and found that the quality of the vaccine was not compromised. However, health officials explain that this does not mean manufacturers should not abide by the cold chain guidelines. Elsewhere around the world, the recommendation to keep the flu vaccine cold is still valid. CDC recommends storing influenza vaccines between 2 to 8 degrees Celsius from the moment the vaccine leaves the manufacturer until it is administered. WHO also categorizes the influenza vaccine as the second most heat-sensitive vaccine and recommends the standard 2 to 8 degrees Celsius cold chain to ensure quality.
Hanel, despite the results, the government has decided to recall all the mishandled vaccines, I hear.
Yes, so after discussing the test results with a panel of medical experts, the government decided to withdraw all 750,000 vaccines that may have been exposed to temperatures outside the storage range. These include 270,000 doses that were stored below 0 degrees Celsius, 170,000 doses that were left on the ground during transit, 2,000 doses that were left outside the recommended temperature range for over 13 hours, and 300,000 doses where the storage temperature could not be verified.
Hanel, what about the people who were injected with these mishandled vaccines?
Well, Sunny, when KDCA announced the mishap 2 weeks ago, they said no one has received these mishandled vaccines. But 3 days later, it corrected itself and said that 105 people had in fact received these vaccines in question. And as of now, this figure has ballooned and now it stands at 3,045 as of yesterday, after 749 further cases were identified over the weekend. So far, 12 cases have been reported where patients showed abnormal symptoms after getting the flu shot. KDCA officials said they are continuing to monitor the patients who were administered with the mishandled vaccines. But the central issue here is that if the vaccines are stored outside the recommended temperature range, it could result in inadequate immune responses in the patient, which then leads to inadequate protection against the disease. So the main concern is not so much about potential complications from a defective vaccine. It's more about the flu shots not providing the level of protection as it should.
I see. All right, Hanel, one final question before you go. What are the next steps for the vaccination program this year then?
So the government plans to resume its free vaccination program as early as next Monday. So during the press briefing yesterday, the government apologized for the mishap. Take a listen.
I sincerely apologize for worrying the public with our mismanagement of vaccine distribution and administration. To ensure a safe national influenza vaccination program in the future, we will enhance our safety measures in medical facilities.
With colder months heading our way, health officials are worried about a twindemic where we have concurrent outbreaks of the flu and COVID-19. So health officials want to suppress the seasonal flu as much as possible to prevent healthcare systems from being overwhelmed. So experts still highly recommend getting the flu shot despite the mishap.
All right, Hanel, thank you for that coverage, and I hope to see you again next week.
See you then.
Right, up next, we meet with an autonomous robot designed to carry out delivery services and has no problem traveling between floors using the elevator. As expected, its presence, that is being hailed amid the heightened social distancing to ward off the pandemic. Do take a look.
Hi, I'm Shinsebyuk. Because of COVID-19, people cannot travel abroad. Instead, they head to hotels for their vacation. And when you are in a hotel room, you might use this telephone to get what you need. However, this hotel has something special. And today, I'm going to try that.
Using the QR code in each room, visitors can easily order anything that they would need. Within few minutes after making a purchase, you will get a message on your mobile phone notifying you that someone's in front of your room. Wondering who's here? I open the door.
Oh my God, this is so cute and so smiley. So let me introduce what it is. This is the Delhi Tower. So this hotel has been test running the Delhi Tower for over 3 months. And to get what you ordered, you need to touch the screen and type in the last 4 digits of your mobile phone number. So this Delhi Tower got me the stuff that I ordered, and I think it's so convenient and such a brilliant idea to have this kind of robot in a hotel.
코로나 이슈도 있고 프라이버시를 중요하게 생각하시는 고객분들도 많이 계셔서 직접 직원과 대면하지 않고 필요한 물품과 음식을 전달받을 수 있는 딜리 타워에 대한 만족도가 높으신 것 같습니다.
Now it is time to say goodbye to Delhi. Bye, Delhi. And now we are going to follow the journey of Delhi Tower.
After confirming the order, instead of delivering items in person, employees put them in the Delhi Tower.
It's gonna move in 1 second, and it says it's moving now. There is Delhi's spot where Delhi waits and stands by until the elevator is coming. Delhi just said it is going to get inside the elevator, and it is very awesome. And once inside the elevator, Delhi knows where it is going. Okay, now we are here. Delhi said it is getting out. Ooh. So there is a sound to let people know that Delhi is moving. It is slowly moving to its destination. And I think it is really brilliant and smart. I really like the machine. And once it gets to the destination, it waits and let people know that Delhi is here.
사람이 하기에는 귀찮거나 혹은 너무나 가치가 적어서 하기 어려운 이제 그런 일들을 대신해 줌으로써 사람은 좀 더 중요한 일에 집중할 수 있게 되고 인건비가 좀 절감이 될 것이고요. 근거리에 있는 가게나 호텔에서는 훨씬 더 큰 매출 신장의 기회가 있을 수 있습니다.
The COVID-19 pandemic has separated ourselves from others. It has also changed how we live, communicate, and even how we eat and drink. And the pandemic has also fueled demand for food delivery services as well. So some people might find it uncomfortable and even anxious to face someone they don't know. To that end, I believe that the Delhi Tower would play a key role in the upcoming contact-free era. This has been Shinsebyuk.
Over in neighboring China, the 8-day Mid-Autumn Festival is poised to end tomorrow, and the hundreds of millions of people who took to the roads, rails and air to celebrate the holiday are now seeking to return to their daily lives. For more, I have Fabienne Kretschmer, a freelance journalist in Beijing, live on the line. Hello, Fabienne.
Hello, Sunny. Thanks for inviting me for the show.
Thank you. Fabienne, China claims it has recorded no local symptomatic case since mid-August and that all the new cases it's seeing, which hover in the teens and double digits, are imported infections, including the 7 it saw yesterday. Do start by telling us a bit about the COVID-19 situation in China, Fabienne.
Yeah, when you talk about the numbers, I cannot independently verify them, but also I have no reason to doubt them at this point because I've experienced a severe lockdown here. It was really strict in the beginning of the year. Millions and millions of people were basically stuck in their residential compounds. They couldn't even go out on the street. And here in Beijing, for example, where you were allowed to go on the street, many people didn't do so. They stayed at home. They always wore masks. So there were many measurements that were quite effective. So now actually the virus is eradicated. I have no doubt about the numbers because of the strict measurements. But I can understand people who actually doubt those numbers. Many people also in China had doubts because in the early weeks, I mean, in the beginning of the pandemic, there were a lot of cover-ups, a lot of intransparencies. So it's kind of a mixed picture. But now when you go out on the street, it's basically back to normal. And life goes on here in Beijing.
I see. Fabienne, I hear authorities there are carefully screening overseas arrivals with stringent measures on foreigners residing in the country as well. Is this true?
Yeah, I know many expats who, for example, work in Beijing or Shanghai, who were outside of China. They couldn't enter the country for more than half a year. And recently, actually, they relaxed the measurements. So you can enter as long as you have a residency permit and you work here and pay taxes here, then you can enter now. But of course, you have to go undergo a quarantine, so 14 days in a hotel. But unfortunately, this doesn't apply for foreign journalists. So I'm still stuck here. For example, if I were to visit my parents in Germany, I could not go back to China. It's still quite strict. This rule applies to foreigners here.
Oh, I see. Now, as I mentioned earlier, Fabienne, the Mid-Autumn Festival comes to an end tomorrow, and almost half of China's 1.4 billion people are believed to be on the move again. What is the atmosphere like there?
Yeah, I think the numbers are quite impressive. I mean, it's estimated that 550 million are on the road. But on the other hand, that's still 20% less than normal. So you can argue that it's almost back to normal, but not quite yet. But I also did travel quite a bit. And if you go to train stations, they are really busy. They are packed. Planes, they are sold out. So it really feels like normal. And for example, I went to Hainan. That's a tropical island in the south of China. The beaches are all open. You can visit cinemas and enjoy your leisure time. So it's really quite different compared to the situation in, let's say, in Europe. So it's really very normal and easygoing, especially if you're outside of Beijing. Here in Beijing, it's still a little bit stricter. That has to do because it's also the political center, and here the authorities are a little bit more nervous. And but in general, I would say many are enjoying their holidays right now.
I see. Fabienne, how are authorities there explaining their containment of the pandemic that is still ravaging the rest of the world?
Yeah, I mean, it's a big propaganda victory, and the government wants to take the credit for that. And to some degree, I think it's also true. I mean, we talked about the intransparencies in the beginning, but after that, the government actually did many things right. One example, for example, when there was not so much known about the virus yet, they already started to separate infected cases and suspected cases. They built specifically designed hospitals, and that in the end turned out to be quite effective. However, I would argue that the real credit should go to the population here. They were really disciplined, didn't leave the house much. They always wore masks and complied with the rules. In the end, I would say that the pandemic actually strengthened the position of the Communist Party, because many Chinese now, they see the TV images of what's happening in America or to some degree also in Europe. And they're quite happy that here they don't have to worry about the risk of infection, at least for now. I mean, here also some people are afraid of a second wave. Now the temperature are getting lower and it's getting colder. So who knows, it can change. But right now people are quite happy to be in China. And also many Chinese students from the US, they happily returned back to China and are happy to be here.
Just out of curiosity, is the public there also being encouraged to get their flu shots this year?
Yeah, that's also a big topic. But the problem here was in China is that the information flow is always not so transparent and open. So, for example, for the flu, I don't have the exact numbers. So I don't really know how if it's really a serious issue right now or not. But yeah, the people are also encouraged to get vaccine for the flu.
Fabienne, well, with the virus under control in China, what appears to be on China's agenda with regard to the pandemic?
Yeah, the big topic is definitely the economy, because compared to Europe, where basically the taxpayer or the governments paid a lot of money to keep businesses going, here actually, especially the vulnerable people, small business owners or people with low income, they really had to suffer. Many went bankrupt. So now what the government is actually proposing is they want to have a paradigm shift. They don't want to depend so much more on exports. They want to strengthen the domestic consumption. And the rationale behind that is actually quite smart. I mean, China is a huge market, 1.4 billion people live there. So it can, to a certain degree, sustain itself. And right now, in the corona year, the international demand is quite low. And also they have a conflict with the US. So they need to focus more on their domestic consumption.
Right. And staying with on the diplomatic front, Fabienne, China's top diplomat Wang Yi's recent tour to Europe he made to improve China's image amid the pandemic, of course. I understand it garnered few diplomatic gains, so to speak. Please tell us more about this.
Well, I have a different opinion that I think that it was a failure, actually, because he was not greeted very warmly and was not so welcome. Actually, many European leaders, they made clear statements also concerning Hong Kong, how China cracked down on the civil society there and also the human rights issues in Xinjiang. So it was definitely not what Wang Yi, the foreign minister, expected. But yeah, China definitely needs to gain some diplomatic ground, and because they angered at least some parts of Europe, that's for sure, because with their mass diplomacy that was perceived as very arrogant, overly nationalistic. But yeah, China cannot lose Europe right now because they have the conflict with the US. It's getting worse and worse. And I mean, Wang Yi was also supposed to visit South Korea. Now that's on hold. And probably it could also be connected to the planned visit of Mike Pompeo, the US foreign minister, who then also had to cancel his visit because of Trump getting infected. But right now, yeah, it's a big geopolitical game. And of course, China wants to keep allies, make new friends, and increase their influence in the world.
Right. All right, Fabienne, thank you very much for making the time to join us at this hour with your thoughts.
Thanks a lot.
COVID-19 is widening social and economic divisions that could further aggravate the pandemic worldwide. For more on this very vicious cycle, I have visiting Professor An Jun-sung from Yonsei University here in the studio. Welcome back, Professor An.
Thank you.
And I also have Professor Oh Jun-sok from Sookmyung Women's University. Good to see you again, Professor Oh.
Thank you for having me.
Professor An, generally speaking, has the socio-economic gap been widened in the wake of the pandemic? I mean, what is the status quo?
Yeah, the COVID-19, right? The socio-economic gap has been widened, and because that the polarization, because it's more important issue in the dealing with COVID-19 crisis, right? According to Wall Street journals, there's the recovery speed from COVID-19 is different based on the education level and gender. And for example, the more educated, the faster you recover from it. So vice versa. So if you the less educated, the slower you recover, right? For example, we see that recently Donald Trump case, right? He went hospitalized for 3 days. He got out of it, right? So it means that you got all the best equipment and the medicine applied to him, but if you're not rich enough to afford the expensive drug or the treatment, maybe you have to wait for like 2 weeks, even months. Right? That's the issue. I think I see that one of the typical example about the polarization happening in U.S. about the medical treatment on the COVID-19, and also there's one Wall Street Journal also point out another fact that the depends on your level of the income. So if you're the higher wealthy people, right, higher income people has relatively suffer less damage compared to the rest of the group, because that if it's the U.S. market, for example, right, the stock market has been recovered pretty well to pre-COVID-19 status. Also, the real estate market in U.S. is actually even more booming at this moment. So I guess that showed a very typical sign of polarization in the society, and it can apply to internationally also. And rich country can make more money out of it, and poor country have more suffering because of some other issues. And it means that it means that it's difficult for people to work for the money. And if you're rich enough, white collar, maybe higher intellectual property right issues, right? A lot of big companies, maybe you can make more money out of it, right? So I think that's the issue, right?
I see. So the risk factors of COVID-19 are not just age and pre-existing health conditions, but also your socio-economic standing then?
Yeah.
I see. Professor O, simply speaking then, are the rich getting richer and the poor poorer? And if so, please do explain this phenomenon for us.
COVID-19 outbreak is a crisis like no other. And then the COVID-19 pandemic have an immediate and then very negative impact in 2020, and the result might be deteriorated in 2021 also. Now, according to UNCTAD forecast, global foreign direct investment will fall by about a 40% decrease. By the end of 2021, it will be deteriorated more and more, which means that it triggers globally to widen the gap between the upper and the lower. The virus itself does not discriminate, but the impact does. Even as Professor Han commented about President Trump, he might be equal under the name of virus. But though we are equally exposed to the COVID-19 outbreak, vulnerability to the outbreak differ from place to place, and then even from group to group over society. Its toll has been massive, and then people in the poorest countries are likely to suffer the most and the largest. In a society, minority group disproportionately suffer from COVID-19 impact. And many of the health factors putting people at a greater risk from the so-called basic disease, such as diabetes, heart disease, and then obesity are more prevalent in minority communities. What about social factors? Job loss or poverty and lower rate of health insurance reduce the ability to cope with the pandemic health impact. I got a data, and in the United States, the proportion of wealth held by those in the top 10% of household income has risen from 60.8% to 70% quite recently. Income and wealth inequality has been on the rise since the 1970s. I mean that even prior to the pandemic, it shows no sign of abating. But I could say COVID-19 has not significantly caused this kind of disparity, but definitely it magnifies the disparity. So COVID-19 outbreak reminds us that income inequality is hanging out around our daily lives.
Right. And talking about inequality, Professor, and a recent report from the U.S. Centers for Disease Control and Prevention found the majority of children, teenagers, and young adults who die from COVID-19 in the U.S. are Hispanics, Blacks, or Native Americans. They accounted for 78% of the fatalities in that age group. What are your thoughts on this racial disparity?
Yeah, that's very interesting. I looked up the article, and then I read the news. I mean, but there was clearly disproportionate death rate among the minorities, and then to be exact, about 78% of deaths. I mean, COVID-19 deaths is they occur to the three main minority group in the United States, including the Black, Hispanic, and Black, and Native Americans. But Hispanic is like 45%. that's about half of it, right? And then I think the black is about 29, and the Native American is 4%. So even among the minority, the Hispanic is about half. And one of my observation about this report actually, they didn't talk about the Asian minority. So I was wondering, because I guess that's maybe Asian population is more, minority is more like going the other, maybe perhaps it's even lower the death rate than white people and white community. I think that might be maybe they didn't increase, but I'm very curious about why they omitted the Asian minority group. But still, there's the Washington Post talk about the issue. Maybe that's the cause is the racial inequality, and which is really deeply rooted. And then because not only racial issue, it's more like socio-economic status, right? If you're the minority group in the United States, it's your last chance, statistically, last chance to get better treatment, right? And then better insurance issues, and then lower income, right? So that's related to I think totally it's about social also, not only social, on the economic, not only but they talk about genetic issue also, but still I think it's a minor one. I think that if you want to talk about it, they should talk about the Asian community, but they didn't even talk about Asian community, and just curious about here. So plus, we have to see that Washington Post, is in Washington, D.C., and now we have U.S. election coming up, and president election coming up soon, right? So very sensitive time in the Washington also. So they talk about Hispanic, because the Hispanic is that, I think that I read the news about this time. This is first U.S. presidential election. The Hispanic, officially become the largest minority group, represented in the vote as a voter. So I think it's a big issue about Hispanic issue, right? In U.S., right, and the racial equality, right? This is in the United States.
Right. Professor O earlier spoke about the rise in wealth among the wealthiest in the U.S. Now, according to humanitarian entity Oxfam, the fortunes of Latin America's 73 billionaires also soared by, I think, $48.2 billion since the start of the pandemic. This occurred while, at the same time, as many as 52 million people in that region and in the Caribbean are on the brink of poverty. How do you explain this reality?
Well, I think it's a very similar thing happening everywhere, actually. Not in the U.S. or Latin America, even in Korea, very similar things happens, because that if you're wealthy enough to have money to buy, so let's say, a real estate, it's much cheaper, right? Nowadays, because the so it's a great opportunity for the people who really super rich to get more money and richer, so you can buy more maybe you can buy stock in cheaper price, you can buy some building or even house even cheaper price, because beside the government regulation on the housing taxation issue, but still could be an opportunity for the super rich, and for the rest it's really the nightmare, but for the very small people would be very benefit of it. And then the point about this one is they talk about under the government about Latin American under taxing policy problem. I think that might be issue, and maybe perhaps a little bit different from other continent. In the U.S., I think it's that disparity between the rich and the poor is more, to be exact. But in Latin America, it's get even worse. I think that it's kind of the gap between the richest and the rest. I think that's a little bit different. I think things got worse in Latin America, and the Oxfam kind of suggesting maybe one of the reasons they have problem is that the lack of social net. Also, there's other problem was that on the taxing government policy, and they kind of estimate the agency, the organization estimate that about like 59% of their annual public health spending will be lost because of their government under-taxing policy, but that's argument. But still, their under-taxing policy could be a factor in Latin America. They're structurally.
I see. Professor, back here in Korea, there is also a visible disparity with regard to job security between regular workers and their non-regular counterparts. I understand the latter, the non-regular counterparts, are losing jobs at an alarming rate. Please tell us more about this.
Yes, I heard it through the media that the temporary workers' job loss rate is 8.5 times higher than that of full-time workers. But the media pay attention to the worker. But as I do know about how difficult it is to get credible and appreciable data, instead those numbers should highly likely to be reviewed, I might suppose, to prove the causality between COVID-19 outbreak and the job loss. Causality differs a lot from the correlation. So I cannot say that the income polarization has widened due to the COVID-19 outbreak based on those numbers. But here we have to take differently, and then we have to pay attention to the job itself. It is true that the idiosyncrasy of professional jobs, licensed jobs, and then even the highly trained jobs might be more durable and resistible in terms of risk insulation in time of uncertainty than the characteristics of relatively, I might say, the routine and then simple jobs, which is highly vulnerable to the economic shock and they're highly affected to the uncertainty. So COVID-19 outbreak is pandemic equally likely, but the durability of holding job against the outbreak might be different. It's not equally likely. That is mainly due to the characteristics of job itself. It is worrisome that there is a growing concern that politicians are fully ready to make regulations or enactment to make this equal, keeping pressure on the upper income workers, take their reward in the name of equality. This might be a wrong way. You cannot make different things treated equal. Brain drain will erode our efficiency or competitiveness. What we need at this moment is to provide a social buffer and the social insurance against the backup, the job loss, not the policy SWAT, to cut it simple. So in this sense, we have to pay attention to our concern and topic of argument from the job workers toward the job's characteristics.
I see. Professor, one other question. I take your attention now to the US. During the presidential debate between President Donald Trump and former Vice President Joe Biden, the two candidates were asked about the economic recovery of the US. Now, President Trump claimed that the US was witnessing a V-shaped recovery. Mr. Biden spoke about a K-shaped recovery. Could you briefly tell us what a K-shaped recovery is?
Yes, it is first mentioned by the Chris Wallace, a famous journalist of Fox News. He really a genuine genius for conceptualizing. K-shape means like this, you know, that the wealthy goes up and then recovery largely to the normal status, but the low earning group, they declining and decline as time goes. There is a K-shaped recovery. In the ongoing recession, let's talk about the industry like technology or retail and then software service have largely recovered and then begun rehiring. Even in Korea, think about it, Market Kali and then Coupang boosted their maximum sales due to this kind of pandemic. As Professor An commented about, it's an opportunity for them. Keep hiring and catching the title like Korean Amazon. But what about travel industry and then entertainment, hospitality, aviation, or cruise business? They might continue to decline as a result that the low-waged workers, low-waged jobs in the industry like those kind of category, they might think about the restaurant staffs or transportation workers and cleaners. They least likely to come back to their work. And global economy has to be transformed and then reformed, moving center of their business gravity toward the digital economy. And untapped business will take the main business podium as a result of this kind of outbreak. Acceleration of reforming global value chain could occur if the rest of the digitalized processes or servitization. Servitization means the combination of the goods with the services, and then this kind of servitization could occur. Then in this sense, a K-shaped recovery is not local nor regional, but also pandemic. And then we have to think about and pay attention to the change of reconfiguration and reformation of resource allocation in the global economy.
Right. Meanwhile, Professor An, data also show that the world's richest countries have already purchased, that is, 51% of the globe's COVID-19 vaccines. What are your thoughts on this reality?
That's very concerning, actually. I just call it a vaccine divide. It depends if the rich, wealthy country will have opportunity to get the vaccine faster and even the more. And if we're not the other side, maybe it's very hard for them to get the vaccine. That's very serious because this is a pandemic situation, not only the local issue, right? Even if one country get all, vaccinized But if not, the next neighboring country is not that happens, it's not going to solve, right? Unless they globally and a certain rate of the vaccination happens, then I guess sure that's the end of perhaps the end of the COVID-19 situation. So I guess that's very concerning. Also, I think that there's some group like such as Oxfam suggesting the people's vaccine, actually, something like the free to anyone and distributed fairly based on the need. And the problem with this one is that in order to make this happen, the multilateral, the conglomerate, the pharmaceutical company have to give up their intellectual property right, which is very critical to their business, right? That's the things. But I think that one of the things they can do legally, actually, I've been working on some other industry on the IT side, and in terms of intellectual property, but especially patent, it's very common that what we call cross-licensing. So I'm not really expert on the pharmaceutical, patent, but I believe that, and most of the multilateral companies, the pharmaceutical, they're kind of sharing their patent pool actually. So maybe perhaps you can work on the same kind of issue that you don't have. If you work on this specific issue, will nobody can pay each other because they have to pay each other, right? So maybe small number of group companies, pharmaceutical, kind of a monopolize or say oligopoly, right? It's kind of oligopoly to try to oligopolize the market so that I guess perhaps WHO or some like international group should take some more initiative to sort of give some creative idea, solution to make something vaccine more available to the public. I mean the general public in the the earth, right? I mean not based on the nationality or the country, right?
Right. Professor, given the gap in socio-economic stances, there are some who are reiterating calls for a universal basic income, even here in the country. Do you believe such a system, the universal basic income system, would serve to bridge the socio-economic gap?
Let's see, the sustainability of economy depends on two pillars. One is efficiency and the other one is urgency. What efficiency is a matter of direction of the economy, the urgency is the matter of timing of the economy. And Northern European countries have experimented, as you commented, the universal basic income for the low income group. In 2017, Finland tested to the unemployed. In the 2018, Sweden also tried to start universal basic income for some targeted low-income group. And also, as an experiment, was selected some social group. Kenya also tested universal basic income, but mostly they had little practical effect. There is an argument raised in Korea also about the universal basic income. Briefly speaking, politically it makes sense, but economically it makes nonsense, especially from the perspective of efficiency. Universal basic income could never be measured to control and then managing this kind of discrepancy. It is a great mistake to assume that you will reap the reward without committing to pay the cost. Universal basic income cannot change the competitiveness or capacity to survive by themselves. They do not keep resort to those kind of urgency. But there is no other, even though there is no other significant evidence about the universal basic income, we have to take it differently. I mean that there is another pillar, is a matter of urgency. Matter of timing, considering the fact that economic urgency, resource allocation should be made even by introducing universal basic income for thinking about the recovery and then capacity to rebalancing to the normal business life. Universal basic income is like a fuel injection into a household or an economy to sticking to this kind of outbreak. So in summary, despite of inflation risk, to ignite the engine of the economy, it needs, and then it might be favorable for the start of those argument, but it should be temporary.
Right.
It is needed to hold the outbreak and restore the normal way business. It should be limited, but to be effective, narrow down the target, and then depending on the level of urgency, that the selective group discrimination could be a good alternative.
Right.
I suppose.
Professor, and a very quick question with a very brief answer, if possible. The world has witnessed its fair share of economic difficulties. We had one in 1997, the Asian financial crisis. We had one in 2008, the financial crisis. Using the lessons learned then, how can market leaders, global market leaders, better prepare for the challenges brought on by COVID-19?
Yeah, I think that we need to get something, try to get mutual cooperation on the issues, such like the vaccine issues, obtaining like creating creating a safety net to not only for the country specific, global, internationally. I think that's the critical issue because it's a pandemic. It's not the local disease. It's a pandemic issue. So I guess it's really time for that international community get together to talk, really come up with the safety net to all the country's people in need. I mean, and especially if it's a poor country, I mean, they have more need for that. So I think that's the things get mutual cooperation, international cooperation. I think the key issue.
Right, a multilateral approach to the problem at hand. All right, Professor An, as always, thank you for your thoughts. And Professor Oh, thank you for being with us today.
Thank you for inviting me.
Right, well, that is all we have for today. We'll be back tomorrow at this hour with a fresh look at efforts to fight the pandemic, including the efficacy of herd immunity. In the meantime, do take care and thank you for watching.